Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. I'm Preeti Kaur. Imagine a world where half of the population experiences a biological process every month, yet in many places it remains buried in silence, stigma or misinformation. Menstruation is not just a health issue, it is a human rights issue. Menstrual hygiene is much more than just managing a monthly cycle. It is about dignity, education, equality and empowerment. Today in Wellness Watch, we discuss menstrual hygiene. In the whirlwind of daily responsibilities, many women often put their own health on the back burner. One critical area that's still surrounded by stigma and silence is menstrual hygiene. With May 28 observed as Menstrual Hygiene Day, it is time we shed light on this natural process and talk about the practices, products and precautions that can ensure safe and healthy periods for all. Here's a report by DD India's Harshita Oberoi.
Every day, women fulfill countless roles: caregivers, professionals, daughters and mothers. But in caring for everyone else, their own well-being often takes a backseat, especially when it comes to menstrual health. Menstruation is a natural biological process that begins in adolescence and continues until menopause, usually between the ages of 50 and 55. It's a vital sign of reproductive health, yet it remains surrounded by myths and misinformation. Ignored symptoms like excessive bleeding, missed periods, intense cramps, or hormonal imbalances can point to underlying issues: polycystic ovarian syndrome, PCOS, pelvic inflammatory disease, PID, or even early menopause. Left untreated, these conditions can lead to long-term health complications. Menstrual hygiene is not just about staying clean, it's about staying healthy. It is essential to prevent infections and skin irritation as well as to reduce discomfort and foul odors. Poor hygiene can lead to serious issues such as urinary tract infections, reproductive tract infections, and long-term fertility problems. It also affects women's confidence and comfort in daily life, whether at school, work, or home. Today, women can choose from a wide range of products: disposable pads, tampons, menstrual cups, and reusable cloth pads. But hygiene goes beyond selection. Hands must be washed before and after changing products. Reusable items must be cleaned thoroughly and dried in the sun. And public restrooms should always be used with caution. But there's another side to the story: the environment. Many sanitary pads are made with plastic that takes hundreds of years to decompose. Improper disposal poses serious health and ecological risks. Sanitary waste disposal is a growing concern. Used pads and tampons should never be flushed down toilets. Instead, they should be wrapped in a paper and placed in closed dustbins. In places where incinerators are available, they offer a safer disposal method. Using biodegradable products can also reduce environmental damage. Observed every year on May 28th, Menstrual Hygiene Day raises awareness of the need for proper period care. The date was chosen because the average menstrual cycle is 28 days long and menstruation typically lasts 5 days, aligning with the 5th month of the year. This year's theme, Together for a Period-Friendly World, highlights the goal of eliminating stigma and taboos around menstruation. In a period-friendly world, periods are normalized, not hidden. By breaking taboos and spreading awareness, we empower women and girls to live healthier, more confident lives. Because a healthy period is not a luxury, it's a right. And every woman deserves to manage her cycle with dignity, safety, and sustainability. From schools to offices, from homes to public policy, it's time we treat menstruation as what it truly is: normal, natural and powerful. Harshita Oberoy's report, Wellness Watch, DD India.
Good menstrual hygiene allows individuals who menstruate to go to school, work and participate in daily life with confidence and without shame. Yet millions around the world still face challenges. Gender inequality, cultural taboos and poverty can cause menstrual health that needs to cause the menstrual health needs, in fact, that go unmet. Each year on May 28th, Menstrual Hygiene Day is observed to highlight good menstrual hygiene practices during the periods and to raise awareness about the importance of access to menstrual products, period education and sanitation facilities. Today in Wellness Watch, we look for the following answers. What is menstrual hygiene? Why is menstrual hygiene important? How should one maintain menstrual hygiene? What causes lack of awareness? And we also discuss status of menstrual hygiene in India. The Ministry of Health and Family Welfare has introduced a scheme for promotion of menstrual hygiene among adolescent girls in the age group of 10 to 19 years in rural areas. Up on your screens, we will get you some hospitals which specifically treat these problems and also address the issues faced by women during these days. All India Institute of Medical Sciences, Delhi, Dr. Ram Manohar Lohia Hospital, Delhi, Loknaik Jayaprakash Hospital, Delhi, and Institute of Obstetrics and Gynecology, Chennai. To help us understand menstrual hygiene better and also how to deal with the challenges with it, we're joined in by doctors in the studio. We're joined in by Dr. Rajesh Kumari, Additional Professor, Department of Gynecology, AIIMS, Delhi. And we're also joined in by Dr. Suman Lal, Senior Director, HOD, Department of Gynecology, Max Hospital, Gurgaon. Thank you both of you for joining us this afternoon on Wellness Watch. Dr. Lal, to begin with, I would want you to explain to our viewers in simple layman terms what is menstrual hygiene and why is it a matter of right and well-being for a woman?
Preeti, when we talk about the menstrual hygiene, it means 52% of women are having menstruations every month, and they should have their menstruations with a dignity and in safe manner. Because if they are not taking care of the hygiene and that time, not taking care of their private part that time, infections can go up and it can cause urinary infections, reproductive tract infections. Later on they can have infertility, problem in the childbirth. Sometimes they can have the infections with the cervix and slowly it can develop in the cancer. Therefore, if we look at all the problems, if the women are not taking care of the menstrual hygiene, it's very important to explain them how they can take care of the hygiene at that time. For taking care of the hygiene at that time, they should wash their hands when they go to the washroom, use their menstrual product before and after that. They should take bath every day and they should clean the area with the water at least 2 to 3 times a day. They should dispose the product properly so that no one other person can get infections.
All right, so that was why menstrual hygiene is important. Dr. Kumari, I would take that forward to you. What is recommended for usage when we talk of menstrual hygiene?
When we talk about menstrual hygiene, this should start from parents, mother to tell or to awareness regarding her daughter what is menstruation and when this will start, and during those menstrual period, how to create safe awareness like washing private area, using pad, tampon or cup, and how dispose of those things. So this is important regarding maintaining menstrual hygiene. And in schools, there are some awareness program should be there during their because nowadays menarche is around 10 to 11 year of age. That is very tender age. So we should tell them, we should aware them what is menstruation and how it occur, and at that time what precaution we should take, and how to clean, and disposable pad etc. should be available at the school or where any woman where they are working. So this is regarding menstrual hygiene.
All right, that was about menstrual hygiene. Dr. Lal, help us understand how is menstrual hygiene, or for that matter menstruation, how is it linked, or how is it associated with human rights?
Basically, it is the right of a girl. When they start growing, in our society there are lots of taboo, and they should come out of that taboo. First of all, mother and family members should explain that it is the normal physiological process of the growing. It is not a disease. They are not unpure, and there is no need to think that it is a part of same. And they should talk about the menses freely. They should talk about their pain, whatever the issues they are having. They should talk about easily with their friends, with their teacher and their family. That is the most important thing.
Dr. Kumari, what happens when menstrual hygiene is not maintained?
If menstrual hygiene is not maintained, first of that, there is chances of urinary tract infection. Most common chances, if we are not changing our pads frequently in 3 to 4 hours, we have to change pad. If we are using tampons, so we have to change within 3 to 4 hours. If we are using menstrual cup, then wash that cup, empty and wash that, and then use again. And during that period, clean your area, private parts with water only, and then dab that area for drying. And then you can use your pads or tampons, what you are using. And during this period, we recommend them to avoid tight clothes, like tight jeans or jeggings. They should feel like free clothes, so that humid and like perspiration not done, and for that they can avoid this infection also.
Okay. Dr. Lal, ma'am talked of how it is important for a girl to change pads every 3 to 4 hours, but get us more clarity for young girls who are watching our show. What precautions have to be taken, how they have to go about when they are on their monthly cycle, just for the benefit of our young viewers, the young girls who are watching us, how the monthly cycle has to be dealt with.
First of all, they should have the positive attitude. It is a normal thing, not a disease. The second, if the monthly blood is coming, some girls are having less blood, some girls are having more blood. If they are having more blood, they should take care of the bleeding pattern in proper way. They can change the pad more regularly, more frequently, and cleaning of the private part is the most important area, and they should keep the area dry. Changing the pad or the menstrual cup or the tampon should be done very much in proper way, because the infections can come from if they are putting the tampon for the long time, and infections can go to the shock also. If they are putting the menstrual cup and the menstrual cup is inside the cervix, and sometimes it can cause severe cervicitis and severe pain in the girl. Sometimes the girls are having lots of menstrual pain, and they are said that time they should not go to school, they should not take the medicine, and generally family members keep them at the home. I always say in now scenario, the girls are not sitting at home for 3 days in their life. Better they should take the medications, and that should be provided by gynecologists. Explain them how to take the medication. They can carry the pad in the bags, school bags. They can carry the medicine in their school bags, and medical rooms should be intimated before by the parents, so that they can take in care that time.
All right, Dr. Kumari, is it safe for girls or for that matter women of any age group to to choose and use any sanitary product which they feel like, or do we have, you know, if a young girl is starting with her monthly cycle, is it advisable to stick to a particular product and then switch over as she grows, as the age progresses? What is your take on that? And also, what is the pH intake, the pH level that has to be taken care of the intimate hygiene products during menstruation?
During menstruation, if we talk about using pad, so pad will be changed within 3 to 4 hours, because there is blood, menstrual blood, and there will chances of infection, bacterial infection, and that time if using pads. If they don't have pads, like in remote areas, rural areas, they are using clothes. So they should wash that cloth and dry, and then they can reuse. And regarding tampons also, 3 to 4 hour in they have to change. And as Dr. Suman said, menstrual cup should be removed, wash, and then they can use.
Right.
And that was, as Dr. Suman said, previously in our, if we talk about our Vedas and other Hindi
Scriptures, yes.
menstrual, in those 5 days, that are because they can rest, and they can proper rest, they can work in protective environment. But when time changes, they make it like a taboo. Right. You cannot touch this thing, you cannot enter in the kitchen. So that was for that thing. Okay. So we have to aware, and we have to aware our public, and not female, also male also.
Yes.
Because he and she both are taking equal part.
Right. All right, Dr. Lal, ma'am talked of how the sanitary products have to be changed every 3 to 4 hours. I would want you to explain to our viewers, how are the sanitary products disposed of after usage?
Sanitary products should be wrapped in a tissue paper or a cloth or a paper, and they should be discarded in a bin in proper way. If the girls is going to school and they are not getting the good area where they can dispose, they can keep wrapped in their bag and they can come home and dispose there. Sanitary pad or napkin or any product should not be really flush in a toilet, and it is not a very good idea at all. Regarding the pH, generally we say that if the pH is alkaline more, in that cases infections can be more. But lots of products are coming in the market and the girls are using left and right. It can cause lots of harshness in the soft area of the perineum, and it can cause lots of dryness. I request, there's no need to use lots of these products day and night. Better to keep the area simple, clean with the water, and keep the area dry, and that is more than enough for them.
Should a girl also wake up at night to change pads?
It is difficult for the girl to wake up at night because they have to go to the school next day. I would say they can have the double layer and they can use that, or if they are using the tampon, in that cases at least they should change the tampon in 6 hours or maximum of the 8 hours, not more than that. But I would request the girl, they should not use the tampon in the night. It is much better for them, because if they are forgetting for the long time, it can cause problem for them. Better to use pad in the night, so that if they are keeping the pad for a little longer, it will not cause any harm to them.
All right, Dr. Kumari, what is the status of menstrual hygiene in India?
In India, if we talk about menstrual hygiene, nowadays scenario is changed. Nowadays our social media, our schools and our government started a program, menstrual hygiene awareness program in I think in 2014, and this program was started with government, NGOs and private practitioners, along with private practitioner, to aware about the menstrual period and menstrual hygiene. What are the So May 28th is celebrated as Menstrual Hygiene Day, because May is 5th month of year, and our menstrual cycle is 28 days. So 28 May is celebrated as Menstrual Hygiene Day, and this year's slogan is period friendly day or day. So if menstrual hygiene is not maintained, first off, there are chances of urinary tract infection, reproductive tract infection, and when they will progress to younger age, adolescent age, then if they are going to marry, because of this recurrent infections, there are chances of infertility and many other infections.
Right. All right, Dr. Lal, ma'am talked about awareness. I would want you to explain to us, in today's times, is menstrual hygiene still a taboo in spite of technology being so readily available to people these days, people being more educated, people being more aware? What is the status of menstrual hygiene, not just in girls, but also, you know, the society, the other family members who are present? Because this is a societal role. To eradicate something, something as a taboo, it requires a societal effort. So what is your evaluation of that?
Basically, whatever we say that if the lots of media is presenting all these things and lots of availability is there for the sanitary napkin, but talking about the menses is not there in the family today also. We never talk with the girls once they start the menses. We always say keep the things away, keep the things away from your brother, keep the things away from your father.
It has to be
secretive. That is the that is the things going in the mind of the girl from very beginning, and whatever the old age occur, it will not go. We have to do the chuppi todo. That is the important thing.
All right. Also, for our viewers who just joined in, today we are discussing menstrual hygiene. We're joined in by doctors and they are helping us understand why menstrual hygiene is important and how it has to be maintained. And also for the benefit of our viewers, we will have a quick rapid fire question. We'll ask you questions and you can give us very crisp, short answers. Dr. Lal, menstrual blood is dirty or impure, is it?
No, it is not.
Dr. Kumari, foods like curd, tamarind, pickles disrupt the menstrual flow.
No, this will not disrupt the menstrual flow, but many foods can cause bloating sensation. So we have to avoid that, high caffeine and caffeinated and other products.
Dr. Lal, is menstruation and menstrual cycle the same?
Is the same, but menstrual cycle means it comes every day. Therefore, we say that menstrual cycle. If the period remains for 5 days, we say that it is the menstruations. But practically is the same.
Dr. Kumari, if a girl misses the period, does it always mean that she's pregnant?
No, if it's sexually active, then we can think about pregnancy. Otherwise, this is not pregnant.
Dr. Lal, one should not exercise during menstruation as it increases the severeness of the cramps. Is it so?
Not in all cases, but in some cases, uterine contractions can be more. If the girl is experiencing more cramp, then we say that don't go for much vigorous exercise of the abdomen. It can increase the cramp.
Dr. Kumari, every menstruator experiences PMS, that is premenstrual syndrome. Is it so?
In some way, every girl faces this premenstrual
syndrome.
Syndrome. So this might be mood disturbance, sleeping disturbance, and mood swings, bloating sensation, pain in lower abdomen. So there are some type of symptoms they are frequently having.
All right. So thank you so much, both of you, for joining us on the show Wellness Watch this afternoon. With that, we come to the end of the discussion here. So both our doctors helped us understand why menstrual hygiene is important. So we know that menstruation is nothing but a very normal biological phenomena, and adolescent girls and women should understand that they have the power of procreation only because of this virtue. Menstrual hygiene is crucial for a woman's health, well-being and overall quality of life. It directly impacts reproductive health, reducing the risk of infections and promotes comfort and confidence. Addressing menstrual health and hygiene also contributes to the dignity and empowerment of women and girls by tackling stigma and promoting access to safe and affordable products. With that, on that note, we end this edition of Wellness Watch here. Thanks for watching. Till we meet next, take good care of yourselves.